How many foramina and fissure are communicating with the Pterygopalatine fossa? Options are 4 to 5, 7 to 8, 9 to 11, 11 to 13. Answer of this question is the 7 to 8. So, communicating foramen with Pterygopalatine fossa is about 7 to 8. The Pterygopalatine fossa is inverted pyramidal space which serves as portal for the number of endoscopic approaches to the anterolateral skull base. This pyramidal region is formed by the pterygoid plate posteriorly, maxilla anterolaterally, the perpendicular plate of the palatine bone medially, and the body of sphenoid superiorly. So this is having four walls. Posteriorly, pterygoid plate, maxilla anterolaterally, perpendicular plate of the palatine bone medially, and the body of sphenoid superiorly. So this space is inverted pyramidal space is called Pterygopalatine fossa. This Pterygopalatine fossa can be divided into two compartments. Anterior compartment having fat and blood vessels, while the posterior compartment having neural component. There are 8 different foramina that transmit various neurovascular structure through the Pterygopalatine fossa. Infraorbital nerve, zygomatic nerve, infraorbital vessels, ophthalmic vein passes through the inferior orbital fissure anteriorly that communicate to the orbit. So Pterygopalatine fossa communicate with the orbit is the inferior orbital fissure. So anteriorly one foramina is the inferior orbital fissure. Medially, the sphenopalatine foramen carries the sphenopalatine artery into the nasal cavity. So medial communication is the sphenopalatine foramina, that is second foramina. Third foramina is the lateral foramina, that is called pterygomaxillary fissure, which communicate to the infraorbital fossa. And inferiorly there are foramina for the greater and lesser palatine canals that transmit the greater and lesser palatine nerve and vessel which supply the palate. So inferior communication are two foramina, greater and lesser palatine canals. And there are three posterior foramina which include foramen rotundum for the V2, median pterygoid, median canal for the median nerve, and pharyngeal palatovaginal canals in the posterior wall. So three canal are there in the posterior canal, that is foramen rotundum, median canal, and pharyngovaginal canal. So total 8 foramina are there in the Pterygopalatine fossa. So in summary, there are 8 different foramina. Anteriorly one, that is inferior orbital fissure, medially one sphenopalatine foramen, laterally one, that is pterygomaxillary fissure, inferiorly 2 greater and lesser palatine canals, and posteriorly 3. These are foramen rotundum, median canal, and pharyngeal canal. So these are 8 different foramina in the Pterygopalatine fossa.